Welcome everybody to this relatively short webinar on EMDR therapy training available in New Zealand. Thank you to all of you who agreed to come along for the day from across the breadth of the Motu, and we have participants from a broad range of areas from Te Whatu Ora, corrections, private practitioners, Orangatamariki, corrections, and so on. So the plan for today is we've got about half an hour. I'm going to be presenting a brief PowerPoint presentation for about 20 minutes maximum. We've got Marianne Stevens, who's a clinical psychologist and EMDR trainer who works alongside me at the University of Otago. And she's going to be taking Q&A. So please do not use the chat function on the webinar, but use the Q&A function. Marianne will be collating all of the questions that come in, and we'll make sure that there's enough time to answer all the questions. If need be, and if people have time, I'm very happy to carry on beyond the half hour, but we'll understand if people need to go. So Hadley, I'm ready to start the PowerPoint presentation when you are, if that's okay. Lovely, thank you. So this is a presentation predominantly focusing on the EMDR therapy training presented by the University of Otago, but I will be talking more broadly about EMDR therapy. So if we could have the next slide, please. Good. So this is the areas that I'll be covering during this brief presentation. For those, some of you may not know too much about EMDR, so I'll talk about that, talk about what it's good for, how does it work, the theories behind, a little bit about how it works, why your clinicians or why you personally might wish to train in EMDR therapy, what's the training look like, where you can get it, because we're not the only providers of EMDR therapy training in this country. How much does it cost, and who can train in EMDR therapy? Thanks, Hadley. So what is EMDR therapy? EMDR therapy is a relatively new therapy. It's been around since 1987, developed by a clinical psychologist in the States called Francine Shapiro. And it's based on a paradigm of psychopathology, which is unique really to psychological therapies and to psychiatry. And the paradigm is that we all have an innate processing system based in our brains, which allows us to process information from an event which occurs through to an adaptive resolution, where it is shifted from the limbic system in our brains through to the long-term memory up in our cortex. And the theory is that when a traumatic event happens, something which our brains aren't able to process, that this innate information processing system gets blocked. And because it gets blocked, the information gets stuck in the form in which it was encoded at the time, which is the basis of post-traumatic stress disorder and all other trauma-related disorders. EMDR therapy is a therapy which targets the information processing system that has got stuck and unsticks it or unfreezes it and defrosts it, so that the information that was stuck, the trauma information, can be defrosted and finally processed through to an adaptive resolution. So next slide. What's it good for? Well, it was originally developed for post-traumatic stress disorder, and in fact, the World Health Organization has done sufficient reviews of the evidence base and the research around it to recommend it as first-line treatment for the treatment of post-traumatic stress disorder. And they did this in 2013, so quite some time ago now. And along with trauma-informed CBT, these are the only two psychological treatments recommended for the treatment of PTSD by the WHO. Now, PTSD is really common, 4 to 6% in the general population, 24% in corrections, up to 35% in severe mental illness, which is what, of course, we're dealing with in the Te Whatu Ora mental health services. But it's also increasingly being recognized as an effective treatment for other trauma-related disorders in which there's a trauma component to those disorders, such as complex PTSD, panic disorder, some phobias, in fact, there's very good evidence now for its treatment in depression, chronic pain, and evidence, but not such good evidence for its effectiveness in addictive disorders. Thanks, Hadley. How does it work? Well, like all other treatments for mental disorders, we don't really know how it works. We don't know how CBT works. And surprisingly, we don't really know how medications work. But there are 5 to 6 theories now. And the most predominant theory at the moment is that the bilateral stimulation, the eye movements in EMDR therapy, tax the working memory more than the trauma memory is able to tolerate. And as a result of that, the what's called the default mode network in the prefrontal cortex is reactivated. And so the processing, which wasn't able to happen previously, is able to kick in again, and the prefrontal cortex kicks in. And finally, memory, which wasn't consolidated in the long-term memory, is able to be consolidated. And a lot of this works by downgrading the orienting response. There was a theory about 20 years ago now that it was similar to REM sleep, but this has been pretty well disproven. Okay, next slide. So why should your clinicians learn EMDR therapy? Well, basically because EMDR therapy works. It's a really effective treatment for PTSD and other trauma-related disorders. It's quick. In Holland, the government or the Ministry of Health equivalent in Holland asked for some research to see whether trauma-informed CBT or EMDR therapy was quicker. And for single episode traumatic events, EMDR therapy was 1 hour quicker, coming in at around 3 hours, 40 minutes for a single episode post-traumatic stress disorder to be fully treated. It's a much easier treatment than trauma-informed CBT, which is a re-exposure desensitization treatment. And trauma-informed CBT, for those of you who have done it, you will know really requires a lot of exposure to the trauma memories, and there's a substantial risk of therapists developing a trauma response as well. In fact, EMDR therapy doesn't require exposure to the trauma memories in the same way. And it's a very controlled exposure for a short part of the treatment. There's a side effect of EMDR therapy in that overall mental health function improves. And there's a trend towards other conditions resolving spontaneously because of what's called the generalization effect. And there's also a trend for patients needing lower doses of medication for a variety of disorders after the EMDR therapy has been completed. So next slide. So what does EMDR therapy training look like? The training as it was first developed in the States was a training which consisted of 2 long weekends of training, which was a mixture of lectures and practicum. And the practicum component is where clinicians learn to treat each other and process memories which they bring to the training. So clinicians attending trainings come to a long weekend, then go back into their clinical practice it, have a minimum of 5 hours of supervision, come and do a second weekend, and then have another 5 hours of supervision thereafter. So that's what the original training looks like. And in fact, the private trainings available in New Zealand follow that same structure. The University of Otago training is substantially different, and I'll come to that shortly. So next slide. So the private trainings which are available in New Zealand are the franchise trainings. We have 2 trainers who offer the EMDR Institute trainings, which is a franchise training from the States, and another trainer up in Auckland who offers a training based on an English model. And those trainings followed that same structure that I was telling you about in the last slide. There are 20 hours of lectures, 20 hours of practicum, and a recommended 30 to 35 hours of EMDR clinical practice. One of the facets of the franchise trainings which are available is that they also offer online trainings where the practicum is also available online. This came about as a result of COVID when we weren't able to do in-person trainings. The University of Otago training has made a conscious decision not to offer online practicum trainings because we feel that they are substantially suboptimal and don't offer the type of input which are available when you do the skills practice in person. Although, should there be another lockdown because of COVID or other viruses, then we would reconsider, of course. Next slide, please. The University of Otago training is substantially different. We offer more hours of lectures, an extra 10 hours of lectures each year. It's divided into 2 years. The first year of the course, we offer a basic EMDR therapy training, which is covers a lot of it covers the same curriculum as the franchise trainings, but we have developed it to be specifically tailored for the New Zealand culture and the New Zealand service requirements. We have twice the hours of practicum, and it's also competency based. So we assess competency through written assignments, video assignments, and an exam at the end of the course. And we also assess competency within the supervision sessions of the case presentations. The second year, which isn't offered by the private trainers, is for advanced EMDR therapy, covering many of the presentations which are seen in everyday clinical practice in a New Zealand setting. So thanks, Hadley. Next slide. So we're going to show you a brief clip now, which gives you some of the insights into the training from Marianne, our other trainer, and some of the student example or student feedback that we've been given. So thanks, Hadley. Ready when you are.
I'm Marianne Stevens. I'm a clinical psychologist. I work in private practice in Wellington, but I'm also part of the Otago University EMDR therapy training. Francine Shapiro discovered there was this surprising link between moving your eyes side to side and the reduction of distress about past events and other trauma-based disorders. And many guidelines across the world now approve EMDR therapy as an evidence-based treatment of choice for post-traumatic stress disorder for adults and children. We've designed this course to reflect Aotearoa New Zealand and what we need in this country. We've made it easy by packaging up all the different courses and things that people are doing that are necessary for becoming an expert EMDR practitioner. The postgraduate certificate is designed for experienced clinicians. It's designed for people who work with complex cases. You will go away from this course knowing that you're competent.
EMDR can help you to get into a very deep place of your client's problem.
Now I can see more people for less time, and I can really enhance the outcomes using the learning from this course.
Really understand where their traumas come from and the impact of that trauma.
This is what the research is now showing, one of the two key treatments of choice.
And ask them, would you like to try this and then see if you need medication? And that's what most people want. So when they do that, it's really amazing.
The course recognises that you are already working, you already have your commitments, and you're adding this on top. And I think there's lots of flexibility to be able to complete the course with everything else that you might need to do as well.
This is a tool that works far better than most other things that I've known.
Practitioners who've done this training before have said that even though they have a lot of expertise, even though they've trained in a lot of different modalities, this adds new value. This adds something different.
We are really pleased to be offering the only university-based EMDR course in Australasia. This course is really popular, so please email us as early as possible if you are interested in either the advanced or the basic training. We look forward to having you study with us.
The best part is to discharge people. They are happy, they're well, discharge them well.
I would absolutely recommend it.
So common question is, how much does it cost? Marianne and I are both trained through the EMDR Institute as well, and we used to offer private trainings. At the moment, private training is actually a little bit more expensive per year than the University of Otago training. Is interesting. If you include the cost of the 2 weekends plus the supervision built in, we offer the similar training, but with increased hours, increased practicum time for slightly less than that. And of course, it's a university training, which is competency based, which the private trainers don't assess competency. Next slide, please. Who can train? Well, you have to be a mental health clinician. We have had applications from people with degrees in aeronautical science, which we've declined. 4 years, we ask for the University of Otago for 4 years postgraduate experience. Other private trainers are reducing that down to 2 years. We have to have a postgraduate diploma in a relevant mental health field or higher, because the exposure to the knowledge base requires a capacity for critical reasoning, which you only develop at the level of postgraduate diploma. Full registration with the professional body, of course, and we need evidence of previous experience, prior to experience in providing other psychological therapies, DBT, CBT, IPT, MBT, etc. Okay, thanks, Hadley. So, to sum up, the University of Otago provides a postgraduate certificate. As Susanna, our professor, head of department, said, this is the only university-based EMDR therapy training in Australasia at the moment. And in fact, we're the second university-based EMDR therapy training in the world. It's a 2-year course, but you can just complete the first year, which is the equivalent to the other private trainers, and you will have the skill base to offer EMDR therapy in your clinical practice for relatively straightforward trauma-based situations. In year 2, we offer advanced EMDR therapy covering dissociation, ego state problems, attachment trauma, depression, addictions, chronic pain, and other disorders. We are accredited with the EMDR Association of New Zealand. And perhaps the biggest draw card for us is that the franchise trainings are based on American and British models, and we've built the New Zealand training to really be tailored to the culture of this country, and it's woven in throughout the training and the service requirements of services like the Fata Ora Corrections, Orangatamoriki, and of course with the ISSC contracts with ACC. Now, we've got a link there to the website and an email address, and we've sent out the PDF of this PowerPoint presentation already. So that's the PowerPoint slides. And I think if we stop sharing now, Hadley, and just have my image there, thank you. So if there are any questions, Marianne and I can answer those questions, but I think if Marianne, if you're still...
Nothing written on the Q&A yet.
Okay, so if people have questions, either send them in on the Q&A, or there may be a capacity to put your hand up and we'll see the hand and Hadley can open that up for a verbal question. Marianne, is there anything that I missed out that we should be adding in to what we've already said, do you think?
No, I think good coverage, Tom. And I just want to say I hope to see some of you next year at the EMDR year 1. There's one question here. How much time do I need to spend in Wellington? Well, the 2 block courses is all that you need to come to Wellington for. So that's 2 3-day block courses.
Yep, all the lectures are online, and the lectures are all recorded. They are available after the lectures for you to look at, watch again, and there are lecture notes and PDFs linked to all the lectures. The block courses we run for 2.5 days, from lunchtime on the first day, and they're from 8:30 to 5 on the second and third days. And they are skill based, so you practice EMDR therapy in pairs in the block courses.
There's a question here that would be good for you to answer, Tom. I'm looking at combining EMDR and psychodynamic psychotherapy, and I'm interested to hear your experience in bringing the two together, Tom.
Thanks for that question. EMDR was originally just called EMDR, and then in 2010, Francine Shapiro changed the title to EMDR therapy, recognizing that it's a psychodynamic therapy in its own right. It's eclectic in that it works well with all forms of psychodynamic psychotherapy. You will bring in many of the skills that you have. The difference is that EMDR therapy has a very structured component to it, but within that structured component, you will be working with degrees of transference, countertransference, using what are called process interweaves to regulate attunement of the client whilst they're experiencing the therapy. So yeah, it's very much it's very compatible with psychodynamic approaches, no matter what psychodynamic approach you're having. If you don't have the 4-year postgraduate qualification, then you can write in to the email address that we've given you and ask for some advice about whether your prior training does meet the eligibility criteria. The eligibility criteria are set by the EMDR Association of New Zealand and are adhered to very tightly. And that's because the EMDR therapy, it appears relatively straightforward and simple, but in fact is quite complex. So when can we expect confirmation of enrollment? Once you apply, the application process is actually changing over the weekend, but our senior administrator, Maria Fitzmaurice, responds to applications as fast as she can. And then we process through you will need to send in your transcripts. And then we check that you meet eligibility criteria. Once those have been checked by either Marianne or myself, then you will have confirmation of enrollment. Within the practicums, you work in pairs on your own personal story, but during the year, you will need to, in your clinical practice, do 40 hours of clinical practice after the first block course, 40 hours after the second block course. And the total cost of $2,500 includes supervision, and it's $2,500 per year. How can we expect confirmation of enrollment? I think we've covered that one. Maria Fitzmaurice, our senior administrator, is really good, and she gets back to you as fast as she can. And
there's another thing that Maria has always said, that if you're interested in the course, to get hold of Maria first, rather than going through the application channels first, to give her a heads up that you're interested, and then she can push things along from her end. So,
yep, and she's good. Any funding from TAPO? Nice question. I'm sorry, but there isn't any funding from TAPO at this stage. There is funding for the CBT course. That was a one-off, which there was an alignment of the stars when they applied for funding from TAPO for the CBT course. That's unlikely to happen ever again. There is, it depends on your professional background, whether you get supportive funding. There are various channels where nurses and social workers can apply for scholarships, but not directly from TAPO. So that's a huge shame for us, but and we explored it with our head of department, but there was nothing going to be forthcoming. And we started putting an application in for the recent funding round that the government put out, but we didn't meet their very tight eligibility criteria.
And Tom, can we just explain about how the courses run every year, but it just happened that next year we're not running year 2?
Yeah. So we've developed the course over the last few years. Next year, we're running year 1, and in 2026, we'll be running year 2.
And then from there on in, we'll be running year 1 next year, plan, and year 2 each year. Plan.
Yeah, we're hoping to. Yeah, that's the longer term plan, but we're hoping by 2027, yeah, hopefully, possibly even 2026, we'll be able to run both years concurrently. So I think if that's no more questions coming in.
Could you say more about admission changing over the weekend? Started with the
yeah, the COP application. Yeah, it's because in the last month or so, we've been accredited as a postgraduate certificate, and the university hasn't quite caught up with the paperwork involved. So, Maria, as you said, Kerry, you should be able to apply directly now for the postgraduate certificate. But if you have any problems, then get back in touch with Maria. Several clients that they found EMDR therapy re-traumatizing. What are the risks of this therapy? If EMDR therapy is re-traumatizing, then the EMDR therapist is doing something wrong, is the answer to that. And the training that they have received wasn't sufficiently robust to ensure that it wasn't re-traumatizing. The training should be sufficiently robust that at the end of every session, the client has been able to be regrounded, settled, and taken out of the trauma processing structure so that they are able to go home. And there's a very clear process for ensuring that EMDR therapy doesn't start if the person is not able to do the trauma processing. It's much more likely that trauma-informed CBT can be re-traumatizing. I find it very upsetting when I hear stories that patients have been re-traumatized as a result of EMDR therapy. And that's of great concern to us. We have, we spend a lot of time training our students to make sure that the risks of re-traumatization are minimized. That's why I think we've spent more time on the lectures and on the practicums to make sure that that risk is minimized, and also on the assessing competency, because if our students don't develop competency in the therapeutic process, then they're not going to pass the course.
And from my opinion, the institute training and other trainings that have come to New Zealand, so someone can attend a training, but they not carry on and continue their development. They may not carry on and continue their case consultation. They may not carry on to get accreditation to assess their competency and things. So just doing the course, one course, doesn't enable someone to do EMDR safely.
Yeah. And I think that's a big part of the reason that Marianne and I are not really training using that EMDR Institute model anymore, and that we've really worked hard to develop a more robust competency-based training, which from our perspective makes sense given the types of clients that we are exposed to working with in this country. Okay, so I mean, if you have further concerns about clients that you've heard about being re-traumatized, please send us an email and I can expand on that answer substantially. I mean, that's for Marianne and myself, that's a huge issue. Deadline for the application? No, we'll be receiving applications through until the end of January. How many hours study per week is required? There are 2 textbooks which are required reading, but that would be the textbook by Shapiro, EMDR Therapy, 3rd edition, and there's another textbook which is required reading, which is by Barbara Hensley, and it's the EMDR Therapy Primer. So those are the 2 textbooks. In terms of study per week, there will be a few papers that we will be recommending that people read, but The main part of the study, in fact, is the clinical practice and the reading of the lecture notes, which will be supporting the lectures, of course. The reading of the lecture notes, hopefully students will be doing throughout the year, but there is a viva, an oral exam at the end of the year, which is based predominantly on the lecture notes and the lecture slides. So there is a requirement that those notes are read. And how many hours per week? We say probably 4 to 5 hours per week maximum at the very most. But as Mei Lee said in the video, it's very achievable on top of your normal clinical practice and your home life, looking after children, dogs, pets, and so on and so forth. So yeah, when I've checked in with the students, and we've had students from a broad range of clinical backgrounds, there's been a consistent response that we've pitched the study hours about right, not too much, not too little. So about this same amount that you would have for any postgraduate certificate.
And could I say, if people are worried about exams, don't worry, it's an open book exam.
Yes.
It's really just a way to make sure that people actually sort of review everything at the end.
Yeah, we haven't had anybody fail the exam. The start and completion date, Paul, we start at the beginning of the academic year. So I think the first lecture for next year is towards the end of February. And the completion date, we run the vivas either the last week of October, the first week of November. And the dates for the block courses are out. I think the first block course is at the end of March, and the second block course is either late July or early August. StudyLink will cover, assuming that StudyLink will cover this course. I'm not sure what StudyLink is, I'm afraid. Do you know, Marianne?
Well, I suppose it's anything that is a recognised Otago University course would be covered, wouldn't it? But
yep,
I have no idea.
Okay, hold on a sec.
Student loan.
Oh, it's a student loan. Yeah, it's a postgraduate qualification. So if you can get a student loan for a postgraduate qualification, then yes is the answer to that. All right, should we wind it up there, Marianne? Thank you so much to everybody who's come along. Anne McLean has sent out the PDFs of the PowerPoints, which has the email contact address on the last slide. You're very welcome to drop Maria an email at any stage, and if she needs either Marianne or myself to answer it, we will certainly do so. So thanks very much.